Welcome to Gracia Institute of Ultrasound Medicine. Like you all know, I'm Dr. Chukuma, your clinical sonologist and course director. Today we're going to be talking about the second lecture on this series of level 1 training, and that is going to be Knobology. That is getting to know your ultrasound machine, the basics. You must master the controls and produce images such that you can make good interpretation. We are going to look at the knobs now. The first thing is for you to know how to power your machine. First thing, you have to power your machine. Look for the power button, like this machine. Sonologist, the power button is here. Once you power your machine, the machine is on. Make sure your probes are connected. These are your probes. They are connected. Convener probe, the linear probe, and transvaginal probe. After your probes are connected, you get to your examination presets. You need to get the presets you need for your examination. Do you want to do a transvaginal examination, a convener, or a linear probe examination? So you can see, come closer please. You can see from the machine, the abdominal scan, liver scan, kidney, depending on whatever you want to do. Then you, after selecting your probe, you position your patient. Now we want to look at the modes. We have the B mode for brightness, we have the M mode for motion, and we have the Doppler mode, continuous wave Doppler, the pulse wave Doppler, the power Doppler, the continuous form motion Doppler. With all this, you can measure vessels. For instance, you want to look at how blood flows in an artery. For instance, you are going to go to the carotid artery. You use your surface probe, there is a linear probe, and go to get the vessel. You first of all use your color Doppler. You can see the color moving. That shows you then power Doppler to measure the spectrum. This is the triphasic form, meaning you are in the external carotid artery. Ultrasound medicine is in knobology. The knobology is the language of the sonologist or the sonographer. Here you have to know everything about the buttons you press, what they do. Without the knobology, no matter how good your diagnosis is, you cannot make a good image or even help your patient or the clinician. For advanced learning, we have to go into some other knobs. For instance, the time gain compensation. To look at the brightness at different levels, you use your time gain compensation. Now for the gain, you can see that I've increased the gain, the brightness of the liver has increased. When you reduce the gain, the brightness reduces. Back to what the knobology we're doing, the gain is poor now, so I increase the gain. Now we can see the liver, we can see the right kidney. The liver here, the right kidney there. Now we move to the next knob, which is the depth. If I want to increase the depth, you can see the depth is going deeper into the structures. You can also look at, you can freeze the image. The image is in one part. Apart from freezing the image, you may want to measure. You freeze the image, you click on your calipers, you take your measurements, you can see you've measured the liver. After that, you can make some typing to actually illustrate what you are doing. You click on annotation, you type your liver. This is the liver. So when you're freeze, the button is free again. You keep on scanning. You can see I want to scan now for the prostate of this patient. You can see the prostate. I freeze. I take my measurements with my calipers, and I can take measurements of the prostate in 3 dimensions. I take the prostatic measurement. You see, I take my volume. From there, I can measure my prostate, and this is how you do your measurement. This is just knobology. Nothing serious. This prostate is around 17 mils. When you want to leave your freeze again, you go to B mode. After that, if you feel like you want to change your probe, you press the probe, you can change to linear probe. You can see linear probe. You want to do a breast scan, a thyroid scan, you click on it. So this is all we do in knobology. So now we are looking at the knobology, the knobs. This is the language of the sonographer, sonologist, or anybody interested in scan. The first thing you need to know is your gain. The gain is simply the brightness or the darkness of an image. How bright, how dark you want your image to be. That is the gain button. Then you look at the depth, how deep you want your image to be. Then you go to the focus button here, just for you to be able to focus on the main area of interest. You have a freeze button to capture image and make your diagnosis and analysis of measurements. There's something called the silo, where you can make videos for future references and interpretation. Maybe you'll send to a senior colleague for the senior colleague to review or something. Apart from that, you have a zoom button, which is this, for you to zoom the area of interest so that you can really magnify the area and make your analysis. Saving and exporting the images. You can save your image through the USB, the PAX, or DICOM. USB is called Universal Serial Bus. You see has a USB port, which you can see here. It has a USB port where you can transfer data. And also the PAX, which is called the Picture Archiving Communication System, where you can get all your images, you can transfer it to different colleagues for review. And the DICOM, which is what we call the Digital Imaging and Communication in Medicine. That is the highest of them all. What it does is to store images, transfer images. So whatever you are doing, you must make sure you are saving your image. Like on the machine, you're going to see the save button. Whatever you do, you save it. Once it is saved, it appears that it is saved, and you can always go back to your image for review.